My name's Tyler. How are you? I'm
Good,
your
how are
physical
you?
therapist today. I see you're here for COPD exacerbation, so you're experiencing shortness of breath
Yeah.
and the junkiness feeling. Is that correct?
Yeah.
Okay, so what I'm going to start by doing is I'm going to listen to your lungs, see how they're sounding, seeing if there's any fluid or mucus buildup in any of your lobes. So what I'm going to do is I'm going to place the stethoscope on different portions of your chest and back region, just so I can get a good listen to your lungs and see what's going on, so I can get some more information.
Okay.
So you can just breathe normally. I'm just going to place this on different portions of your chest here. So just breathe normally. Good. Nice and relaxed. Just breathe normal. Good. Okay. Good. So now I'm going to go onto your back side. Just continue to breathe normally for me. Can you take a deep breath for me? Good. Another one. Good. Okay. Good. And one more deep breath. And again. Just one more. Okay, good. So I heard a little bit of crackling in your right lower lobe. All that means is that there might be some mucus or fluid buildup in that region that may be causing your shortness of breath. So what I'm going to do is I'm going to teach you a breathing technique. It's called active cycle breathing. So hopefully that will clear out the airway and allow you to breathe easier and relieving you of that shortness of breath. So what we're going to do is I'm going to have you place your hand right below your ribs here, right in the center. And you're just going to breathe as normal. So just nice, deep breaths like you normally would breathe. Relax, just relax, take breaths. Good. A few more. All right, and now can you place your hands on your ribs here? So right on the ribs. And we're going to work on expanding that rib cage. So I want you to breathe in. Really expand that rib cage and breathe out. And you can try to purse your lips on the breath out. It may be more comfortable for you to do that. So keep your hands here, breathe in and out. Breathe in and out. Breathe in. 2 more deep breaths and expand that rib cage and out. 1 more. All right, so now I'm gonna have you we're still gonna do the breathing, and I want you to, on your exhale, I want you to breathe like this. So like you're fogging up some glass, okay? So breathe in and out. Now you do it a little slower and out. 2 more. And 1 more. All right, so now I'm gonna have you try and cough. We're looking for a productive cough to see if we can get any of that mucus up. So I'm gonna do it 1 more time, and then I'm gonna have you try and cough, okay? In and out. All right, and now you can try and cough. All right, did you feel like any mucus came up?
A little bit.
A little bit, yeah. So I'm gonna have you continue doing this at home and throughout the day to try and get that mucus out of your lobe,
Mm-hmm.
your right lower lobe there, to try and, like I said, clear that airway and make breathing a little easier for you.
Mm-hmm.
Do you have any questions for me as we go forward?
All good.
All right, cool.
Thanks.